Good morning, Southern California. AM 1220 KHTS shows Fred Arnold on Santa Clarita Valley Chamber of Commerce Business Spotlight. Real quickly, I got Dr. David on. I'm going to mention just real quickly because he grew up in Southern California. And you got your training, medical training at UC San Diego.
Correct.
And you're now a specialist it's called UCLA Health, Santa Clarita Primary and Specialty Care.
Mm-hmm. And I specialize in diabetes, thyroid, other endocrinologic topics, but I'd love to talk about diabetes today.
Yeah, we're going to talk about that because a lot of people suffer from diabetes.
Mm-hmm.
And there's two different types of diabetes.
Yeah, so there's many types of diabetes, but definitely most people fall into one of the two categories. Most of us have loved ones or family members that have diabetes. I guess a quick overview would be that we all know that it has to do with blood sugar levels, and diabetes is a disease where our body is unable to properly respond to blood sugar that we consume. That comes from the food that we eat.
Now, from what I understand, there's two different causes. One is not caused by your body just being that way, if you will, or reacting that way, versus the food you put in it.
Right.
So what's the difference? Because some people can control their diabetes just by diet. They're not eating properly.
Of course, yeah. So the first type I think you're referring to is type 1 diabetes.
Type 1, okay.
And that's where your body decides to attack the pancreas, which is the organ that produces insulin, which is an important hormone for regulating your blood glucose levels. So that's something that's a little bit more genetic. You can't, there's not a whole lot you can do to prevent the onset of the disease itself, but there's a lot you can do to control it. Type 2 is a much more common type, and that's where it's a little bit more influenced by lifestyle factors like diet and exercise.
Okay, so the type 2 is more lifestyle influence.
Yes, definitely.
Okay, which is the one you can control. Now, I know UCLA Health is a growing health provider here in the Santa Clarita Valley. They're members of the Chamber of Commerce. They have 4 locations out here in the Santa Clarita Valley. So you really have great care. And when people come to see you, what are some of the things they can do to help keep their diabetes in check when it's a type 2?
Yeah, the real big thing, I would even recommend kind of getting screened before you're diagnosed with diabetes.
Okay.
That's,
so on a normal physical, you get that done at UCLA Health?
Yeah, exactly. At UCLA Health with any primary care provider, they will check a blood test that can really give insight into whether or not you're at risk for diabetes. It's called pre-diabetes. And that can be a big warning sign.
Well, they say, what, 30%? 30% of all Americans don't know they have it, don't know they do.
Yeah, so 30% of American adults actually have type 2 diabetes, and almost 90 million people in the United States have pre-diabetes. And most of those people, about 90% of those 80 million people, don't realize that they're at risk for diabetes.
Amazing.
Yeah. And so to kind of answer your previous question about what you might do with the help of a doctor would really be when you're in that pre-diabetes stage, it's really about optimizing your exercise health and really decreasing the amount of carbohydrates that you eat. And once you have a full diagnosis of diabetes, it's really important to continue to monitor your exercise and nutrition, but also you would benefit from medication and medical management of your blood sugars as well.
Yeah. And so typically, how does that look? Is someone going in? I see them testing their blood.
Yes.
So tell us, of course, to see where their blood sugar is, correct?
Exactly. And I'm glad that you brought that up. That's a huge component of managing any lifestyle type disease, whether it's using a scale for weight management or a food diary for weight loss. Similarly, a blood glucose log is really important for managing blood sugars and diabetes. We usually recommend, there's a wide range of frequencies that we recommend, but we do recommend that people with diabetes check their sugars just to know where they're at and to get some feedback on what foods and what activities are helpful for them and what foods are not. And when they visit their doctor, we'll review their blood sugar levels and talk with them about changes we can make in their exercise levels, nutrition, and doses of medications.
You know, you had mentioned before you came in that just losing 7% of your body weight.
Yeah, so a lot of people, they ask what can they do to prevent diabetes or what can they do to prevent the complications of diabetes. And I'm sure we're kind of hammering this in, but really lifestyle management is key. And it doesn't have to be drastic weight loss. I know a lot of people are kind of targeting those miracle weight loss before and after images, but really 5-7% of your body weight loss, which can, in a 200-pound person, that's like
Well, if I 10
pounds,
15 pounds.
10, 15 pounds, and that's been proven in studies to really reduce the risk of diabetes by about 60%.
That's huge.
Yeah, it's
Just
amazing.
a small amount. That's 5% of your body for a 60% loss and potentially not having it.
Yeah, and 5 to 10 pounds weight loss is doable. 10 to 15 pounds is definitely doable. And we would definitely recommend
And
that
there's a
for
lot of them
everybody.
out there that are just typical, sodas, even some of the energy drinks, a lot of sugar in them.
Yeah.
And when you order your drink at the local coffee house, are you ordering it skinny or are you ordering? How are you ordering? I mean, there's so many things you can do.
Yeah.
To keep an eye on that.
And I'm really glad you brought that up. That was one of another point I wanted to bring up is that a lot of times we think of sugar affecting diabetes, but sugars can be hidden many times. So when you're reading nutrition labels or reading nutrition facts, the big thing to look for is carbohydrates rather than just sugars. Because a lot of foods have high carbs that you might not realize, like pastas, breads,
Refined breads.
fruits, exactly. And so a lot of people don't realize that potatoes and starches are really high in sugar content. So carbohydrates is the food group that you really want to try to cut down on.
You want to keep an eye on.
Yeah, definitely.
Almost you want to become somewhat, I don't want to say an expert, but you really want to study nutrition because nutrition can be about saving your life.
Yeah, I would definitely agree with that.
Absolutely. UCLA Health. UCLA Health is out here. You're on McBean. You have, I know, 4 different locations.
Yeah, we're all over the Northwest Valley. We have multiple offices in Santa Clarita, a lot of different specialties as well. So you should definitely check us out at uclahealth.org.
.org, yeah. And / Santa Clarita if you want to know the local stuff going on.
Awesome. Thanks.
Yeah, Dr. David On, MD. Welcome. Thank you for coming on the show.
Yeah, my pleasure.
Ladies and gentlemen, I hope you enjoyed this segment, the Santa Clarita Valley Chamber of Commerce Business Spotlight. Shows Fred Arnold on AM 1220 KHTS.